Hi, my name is EMABdomenMSKexam. I'm a physician assistant student here today to do your abdominal and musculoskeletal exam. If you could please take off your shirt, shoes, and socks and ensure that your bladder is fully emptied so I can do this exam properly. And I already washed my hands prior to coming in the room. If you can go ahead and lay back and bend your knees. Thank you. I'm just going to go ahead. Do you care if I pull your shorts down a little bit? I'm just ensuring that I have proper visualization in your xiphoid process to your pubic symphysis. So the first thing that I'm going to do before I auscultate is inspect your abdomen for the abdominal contours, for any distension, pulsations, deformities, or any abnormal movements. I'm just going to go ahead and look at both sides. And then I'm going to go ahead and auscultate all 4 quadrants. I'm listening for bowel sounds, and if I don't hear bowel sounds immediately, I will listen for 1 minute in all 4 quadrants. So next what I'm going to do is I'm going to let you palpate or press your stomach, listening for tympany and dullness. Do you have any pain anywhere before I press you? If I did have pain, I would press that location last. The sounds over her stomach are relatively dull. Good. And then I'm going to percuss for sphenic enlargement. So spleen, side, lower, left side, her left side. Can you take a deep breath in? Good. Out. Take a deep breath in again. Out. Good. I did that on the last intercostal space and the anterior axillary line. So next what I'm going to do is palpate. I already asked the patient if she had any pain. She said no, so I'm going to begin with light palpations to feel for any superficial masses and tenderness, and I'm watching the patient's face, noting any signs of distress. Good. Now I'm going to go ahead and palpate deeply, noting any deep masses. And again, watching the patient's face for any signs of distress. And then I'm going to go ahead and palpate the patient's liver. So under here. Take a deep breath in. Out. In. Any tenderness while doing this? Out. Good. Now I'm going to go ahead and palpate the patient's spleen. Deep breath in. Out. One more time. Out. Good. And then once I'm done with that, can you go ahead and sit up for me? I'm going to palpate CBA tenderness. So can you tell me if you feel any pain while I do this? I'm going to hit once lightly and then softly. So I feel at the end of the costals. I'm going to move my hand over. Any pain? No. About now. Pain? Pain? Good. Alright, and then I would perform a rectal exam after that. So now we're going to go ahead and move to your musculoskeletal exam. During this exam, I'm going to be looking for symmetry, any signs of inflammation, edema, effusion, any abnormal bone placements, any tenderness, any abnormal movements, the ease of range of motion, crepitus, and any other deformities I might notice. Okay, so what I'm going to do is I'm first going to start, can you stand up for me actually? So I'm going to inspect your posture. So I'm going to look laterally at the kyphotic and lordotic curvatures. Good, can you turn towards me? And then I'm going to inspect the posture anteriorly, noting the alignment of the hips and pelvis, or the hips and the scapula, sorry, the shoulders. And then can you turn around, doing the same thing posteriorly. And then I'm going to go ahead and inspect the spinous processes. Do you mind if I lower your shorts a little bit? There we go. And then inspecting those and looking at her sacrum. Also inspecting the transversospinalis muscles and the sternocleidomastoid muscle. Okay. And then I will begin to inspect or palpate her spinous processes. So just let me know if anything's tender. Good, and then I'm going to palpate the paravertebral muscles. Good, and then I'm going to palpate her sacrum, any tenderness, and the sacroiliac joint. Good. Alright, once I'm done with that, I'm going to go ahead and assess for range of motion. Can you face this way? Looking this way? Alright, can you put your head all the way up? That is extension, good. Look down at your toes, flexion, good. Can you look to your left? Good, that's rotation. Can you look to your right? Good. Can you bring your shoulder to your left ear? Good, that's lateral movement. Can you do the same on the other side? Lateral movement, good. So now we're going to do the same thing, but we're going to do it for your spine. So can you go ahead and touch your toes? Good, that's flexion. Can you go ahead and lean all the way back for me? Good, extension. You can go back up. Alright, can you turn and look behind you as far as you can? Good, rotation. Do the same thing the other side. Good, rotation. Can you take your this hand and bring it all as far as you can go down? Good. Do the same thing on the other side. Good. Alright, so now we're done with that. We're going to go ahead and begin inspecting your arms. So I'm going to go ahead, can you face me this way? So I'm going to go ahead and inspect the shoulder, the acromion, the greater trochanter, or tubercle, or tuberosity, sorry, and the clavicle. All looks good on this side, and I'm going to go ahead and inspect the antecubital fossa, lateral, medial, malleoluses, or no, lateral and medial condyles, sorry. Legs and arms are very similar, right? And then I'm going to look at the olecranon fossa. Good. Then I'm going to go ahead and inspect the carpal bones, the radial and ulnar styloids, and then the fingers, the GIP and PIP joints, and the bones of the hand, and the anatomical snuff box. Over. Good. I'm going to do the same. Now I'm going to look at the scapula. Good. So next I'm going to go ahead and palpate this arm. So I'm going to palpate the acromion, clavicle, forefoot, and the bicipital groove. Good. And I'm going to go ahead and palpate the medial epicondyle, lateral epicondyle, the olecranon process, and the antecubital fossa. Then I'm going to palpate just the arm, palpate the radial styloid process, and the ulnar styloid process, the bones of the carpal. Good, and now I'm going to palpate each of the metacarpals on the anterior and posterior side. And I'm going to palpate the DIP and PIP joints. Good. Now I'm going to do the same thing on the other side. I'm just going to start with inspection. So I'm inspecting the acromion, the clavicle, greater tuberosity, and then I'm going to be inspecting the biceps and the triceps. And I'll be moving down to your elbow, the antecubital fossa, turning it over, the olecranon process, and the lateral medial epicondyles. And then I'll be inspecting the forearm, looking at the carpal bones, the radial and ulnar styloids, the anatomical snuff box, the metacarpals, and the distal and interphalangeal joints. And I'm going to go ahead and palpate just like I just did. So, clavicle, acromion, scapula, and then greater tuberosity, biceps through. Good. And then just palpating the biceps and the triceps. I'll be palpating the olecranon fossa, antecubital, the lateral medial epicondyles, and then the forearm. And again, the radial styloid and the ulnar styloid, and then the carpal bones. And then I will be palpating And then purples, posterior and anteriorly, and then the interphalangeal joints. Good. Next, we're going to go ahead and do some range of motion. So can you bring your arms all the way up for me? That is extension of the shoulders or flexion of the shoulders. And can you bring them all the way back? Good. And then can you bring them like this? Awesome. Can you see me? And then put them down. Internal rotation. Good. Bring it back up. External rotation. Good. And then can you bring both arms if you can? Sorry, I'm sitting behind you. Do you want to face me? Okay. Can you bring them all the way out? Abduction. Can you bring them all the way across? Abduction. Good. Alright, next we're going to go ahead and do range of motion of your elbows. So if you bring elbows like this, pull them up, flexion, pull them down, extension, hands flat, like this, pronation, like this, supination, good. And then we're going to do your wrist. So have your wrist out. Can you bring them in, that's ulnar deviation, bring them out, radial deviation, can you bring them up, flexion, bring them down, extension, good. And then now we're going to do your hands. So can you bring your thumbs like this, like that? That's finger and thumb flexion, then bring them back out, extension, extension. You pull them all the way out. That's finger abduction, bring them in, and your thumb, that's finger and thumb abduction. And then bring your thumbs like this, that's finger abduction, or thumb abduction, good. And then we're going to do opposition, so can you, just follow me. Good. So, all done with that, so can you go ahead and lay back down on the table? We're going to go ahead and move to your, actually, I forgot to do your temporal mandibular joint. So I'm just going to go ahead, can you pull your mask on so I can inspect it? Thank you. I'm just inspecting, looking for any deformities, and then I'm going to palpate it for any tenderness or pepidus. So can you open your jaw? Close your jaw. Can you put your jaw forward, protraction, backwards, retraction, and then side, lateral movements? Good. Now pepidus, all set. Alright, and then you can go ahead and lay back down. Thank you. Now I'm going to be inspecting your hips. So I'll be looking at the ASIS, the greater trochanter, and the joints. And then I will be moving down, inspecting, inspecting the legs. Good. And then I will be inspecting the knee, looking for any deformities, looking at the patellar tendon, the lateral medial malleoluses, and then I will be inspecting the lower leg, looking at the calcaneus and the Achilles tendon, the ankles, lateral medial malleoluses, and then I'll be looking at the feet and looking at the tarsals, the metatarsals, looking at the joints in each. Okay. Now I'm going to do the same thing on the other side. I'm going to go ahead and inspect on the other side. So we're looking at the hip, the ASIS. I'd be doing all of this under clothing. And then greater trochanters, moving down the anterior leg, looking at the knee and the patella, lateral medial, but lateral medial side of the knee, patellar tendon, and then I'll be moving down again. On this side, get the Achilles tendon, calcaneus, lateral medial malleoluses, and then I will be looking at the tarsals and metatarsals. Good. So now we're going to go ahead and palpate. So, palpate the ASIS, there's trochanter. Good. And we're palpating the front, palpating the patellar, medial side of the hip, or the lateral side of the hip, patellar tendon, anterior side of the leg, medial malleolus, lateral malleolus, calcaneus, and the Achilles tendon, and then palpating each one of the tarsal bones. Good. And then I'll be palpating each one of the metatarsal bones. Sorry if you're ticklish. Alright. And then we're going to go ahead and do the same thing on the opposite side. So again, palpating the hip. ASIS, trochanter, anterior side of the leg, the patella, patellar tendon, the medial knee, the lateral knee, and look down, anterior side, medial malleolus, lateral malleolus, Achilles tendon, calcaneus. Moving to the foot, tarsals. Alright, good. Now we're going to do range of motion. So first I'm going to start. I'm going to move you, okay? So we're just going to start with hip flexion, knee flexion, further hip flexion, good. And then external rotation, internal rotation, knee extension, good. And then hip abduction, hip adduction.
And then I would go ahead and ask her consent to do that.
Thank you. Turning over. Such a good patient. And then we're going to text for hip extension. Good. Alright, then you can roll back over. And we're going to go ahead and do the same thing on the other side. So can I have you sit up? And then turn. Yep, and face that way. So I can get clear. There we go. Perfect. So I'm going to move you again. So hip flexion, knee flexion, hip flexion, external rotation, internal rotation, knee extension, okay. Hip abduction, hip adduction. Can you roll on your side again for me? Hip extension. Good. Alright, and then you can roll back over. Can you sit up and face this way? I'm sorry. We're kind of in an awkward position to do this exam. Yep. Alright, and then we're going to do dorsiflexion of the foot, plantar flexion of the foot, flexion of the toes, extension of the toes, dorsiflexion of the foot, plantar flexion of the foot, flexion of the toes, extension of the toes, and then internal rotation of the ankle, external rotation, internal rotation, external rotation. And if you can go ahead and just stay there for me. I'm going to have two things. So, next up, can I have you bend this leg for me? Thank you. I'm just going to go ahead and measure your calf circumference, the widest portion of your calf. Alright, it looks to be about 38 centimeters. I'm going to put this down. Can you lift this leg for me? Thank you. Good. It's also 38 centimeters on the opposite side. So next, can I have you bend this leg as far as it can go? Good. And I'm going to place this on the lateral side of the knee, and then point this side to the lateral malleolus, and this side to the greater trochanter of the hip. Good. It looks to be about 137 degrees. And could you sit up for me and turn that way so I can do your opposite leg? Can you put that leg down, bring this one up as far as you can go? Good. Same positioning, lateral side of the knee, greater trochanter, lateral malleolus. So you might be a little bit, again, about 138 degrees. Good. So we are all done with your exam. Thank you. You've been a great patient today.
And then I'll go ahead and have you